Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in their profession. So this video is for the nursing aspirants who are preparing for their competitive examinations. So today's video is about drug calculation, that is drops per minute. So next forthcoming videos will be related to the other drug calculations in the nursing. So the nursing aspirants who are preparing for the examinations, it will be easy for you. For a better understanding, I have given certain questions and a live video how we have to solve it by the formulas. So without wasting much time, let's get started into the video. The formula for calculation of drops per minute is, so we are going to see what is the formula for calculation of the drops per minute. Drops per minute is equal to total volume of fluid in ml into drop factor divided by total time of infusion in minutes. So in certain questions they will be giving in hours and we have to convert into minutes. So drops in 1 ml is, so for microset we use 60 drops for mostly pediatric population. Next is for adults, it is macroset for 15 drops. If sometimes in certain questions they will not give you the drop factor. In that cases, this is a standard one, we have to use 15 drops, and for pediatric 60 drops. If sometimes they will be giving the drop factor in the question itself. So here the first question, an infant is receiving parenteral therapy. The IV order are 400 ml of D5 0.45 NS to run in 8 hours. At what rate should the nurse maintain the hourly rate? So here they have given how much fluid has to be administered and for how many hours have to be administered, and here they have not given any drop factor, but whereas in the question it is given that an infant, that means we have to use the microset drop factor, that is 60 drop factor. Okay, so for pediatrics we mostly use 60 and for adult 15. So here the total volume of fluid in ml is 400 ml. Okay, so next is they will we have to see what is the time we have to give the fluid, that is here the time given is 8 hours and the drop factor is 60 drops. So by the question itself we have to understand an infant means pediatric, so for pediatric we have to use the drop factor of 60 drops. So total time is 8 hours. So how we have to convert into minutes is, so whatever the hour they have given we have to multiply by 60 minutes, so it will be converted into minutes. So then we have to apply these all, this is a direct question. Okay, so we have to apply these all values in the formula after converting the hours into minutes. So 400 into 60 drop factor divided by how many hours, how many minutes we have to administer, that is 8 hours into 60. So when we do this division and do the proper multiplication, we get the answer 50 ml per hour. So this is the answer for this question. So it will be easy when you know sometimes these questions are direct questions. So it is easy to write in a proper way, and sometimes what happens, we have to convert it into the standard forms what the formula wanted. So next question we will see, we will have a live video how we have to solve it. So how many drops per minute would you administer when the doctor order states that the client should receive 1000 cc of fluid for 8 hours and IV set delivers 20 GTCS per cc? So that means they have given drop factor. So if in questions they are giving drop factor, means that drop factor only we have to use it. If they are not giving only, we have to use the standard one, that is for adult 15 and for pediatric 60. So here the amount of fluid to be administered is given, that is 1000 cc. The time of administration is also given 8 hours, and the drop factor is also given in this question. Okay, so we'll see what is the answer. Option A 42 GTTS, option B 51 GTTS, option C 31 GTTS, and option D 48 GTTS. So here the answer is 42 GTTS. So you also do how you have got this 42 GTTS. So here you see, so drops per minute we have to calculate. So according to this question, the client should receive 1000 cc. Okay, so next is GTT in the question itself, the drop factor is given is 20. So that only we have to use. So time is 8 hours they have given. So according to formula, the volume of infusion into drop factor divided by time in minutes. So we have to convert that 8 hours into minutes. Okay. So that means we have to multiply by 60. So applying the value in the formula, 1000 cc into 20 GTT is divided by 8 hours into 60 is we have to convert into minutes. So it is in 8 hours, no? So that has to be converted into minutes as per the formula need. So when we are applying these values in the formula, when we do the proper multiplication, when we are using the BODMAS method, then after doing the calculation, we will have a by dividing into 2. First we have to strike out the 0, then we have to divide it by the common divided factor, that is 2. So 2048 it will be multiplied by 2. So that is a simple term we have to make it. So if we are making into simple term, we get as the 125 by 3. So it is easy to divide the 125 by 3. So we get about 3 4s are 12. So here we have 5. So 3 1s are 3. So we have remaining 2. Right? So 3 means 4 5. So 2 will be there. So to get 0, we have to place a decimal here, and 3 6 are 18. So again, we need not go for next and next level. So round off we have to do it. So if it is a point above 0.5, we have to round it into next numeric, that is 42 GTT. So this is how we got the answer in the questions. So next question we will see. A patient is to receive 3000 ml of 0.9% NaCl IV in 24 hours. The intravenous set delivers 15 drops per millimeter. So here drop factor is given 15. The nurse should regulate the flow rate so that the patient receive how many drops of fluid per minute? Option A 21, option B 28, option C 31, option D 42. So answer is 31. So you along with me, you also do the calculation, because already it is given in the question in the very straight form, and we have to only apply it in the formula. That is, we have to convert the hour into minutes. That's it. The fluid is being given in ml. So we need not convert those in case liter or ml into in a proper way. So we will put it in the formula. See, the patient received 3000 ml of 0.9% of NaCl. So we need not worry what solution they are administering. Okay. So we should only know what is the volume, what is the time, what is the drop factor, so that we can calculate the drops per minute. So here time is they have given 24 hours and drop factor 15 GTTs they have given. So here how many drops per minute we have to calculate. Okay. So here we have to apply the values in the formula. So drops per minute is equal to total volume of the fluid into drop factor whole divided by total time of infusion in minutes. So here we have total volume is 3000 ml. We have to put it in the formula. Okay, so time is 24 hours. We have to multiply by 60 in order to convert into minutes. So when we apply those values in the formula, like 3000 into 15, so divided by 24 into 60. So we get 15 3s are 45, and adding those 3 zeros, and we get 1440. So striking out both the zeros, we have to do the simple form of division. So when we do the simple form of division, we multiply by a common number, right? So like 2 or 3 like that. Then when we simplify it, we get a value that is 30.8. So we have to round it. Since it is above 0.5, we have to round off into 31 drops. So in the questions we have seen the options, no. So by this applying the formula, we get the proper answer. So this is very simple and easy, but sometimes to apply those values in the formula and get the answers. And I hope this video will be useful for the nursing aspirants who are preparing for the exams. Kindly like it, share it and subscribe it, and thank you for watching.